on J101.9 FM. There will also be a live broadcast on our Facebook and Instagram pages, all at Dietitian Michelle. And rest assured that your diet questions and dilemma will be well attended to.
It's Diet Talk with Dietitian Michelle. Good evening, and it's Michelle that is talking. Today, I'm going to be the presenter, the guest, the host, the everything for today's show. Alright, I've decided that I'm going to help you know a little bit about Michelle and my passion. I had a nutrition clinic called Citadel Nutrition Consults at Crispan Hotel, where we provide nutritional consultations and plan diets for the management of disease conditions like diabetes, hypertension, cancer, obesity, kidney impairment, and many other diet-related diseases. Then I also had the production of a food processing company called CNC Smart Foods. I'm going to dwell on that today. And I also had a culinary section of Citadel Nutrition Consult where we prepare meals, food for the treatment of the disease conditions I mentioned earlier. I'm so excited about this because I have gotten a lot of good news, a lot of testimonies, a lot of reviews, positive reviews from my clients and even from family and friends. So, talking about CNC Smart Foods, let me tell you what gave birth to CNC Smart Food. As a young dietitian, very zealous, eager, always ready to make recommendations, plan diets, help people live healthy, I noticed there was a gap. There was something missing. I couldn't really help. I struggled to help my clients achieve the results that they desired. And now, so after planning a diet, for instance, for someone who has diabetes, and then I say, don't eat this, don't eat that, I take out this, I take out that, then the patient asks, Dietitian Michelle, if you have taken this and that out of my diet, what then should I eat? I go blank. Just like this. Why? Because I had no real solutions. I had nothing to recommend. I didn't know what to say. There was no solution. And so you see, head knowledge without practical most times makes your practice futile for dietitians. So I had to find solution. I had to find answers. I had to help my clients to achieve results, so that when I say you shouldn't eat this, you shouldn't eat that, and you ask me what then should I eat, I'll tell you there is an alternative. There is an alternative. In fact, do you know that there are so many alternatives to what we are used to eating that we think that if we stop eating, we are not going to find something else to eat? No. You've just not thought about it, or you have not discussed your concern with Dietitian Michelle. There are alternatives to the things that you are eating that you need to change. So I started working on those alternatives, and that is what gave birth to CNC Smart Foods, what I consider to be a food solution in the treatment, in the management of disease conditions. Now, if you're not driving, I think you should clap for me. Okay, but if you are, just keep listening. I'm going to tell you more about CNC Smart Food. So, my passion to help people to eat healthy, my passion to help people in the management, in the treatment of their disease conditions is what gave birth to CNC Smart Food. What happens here? We package food products, most times foods that are not common, or foods that are common, but we package in a unique mix to help people achieve their result. Now, every single product that we package in CNC Smart Food is a solution to a problem. I'm going to list out a few, then I'm going to dwell more on just one particular one. Now, there are many food products, and of course, as dietitians, a lot of other food products are coming up. So we keep adding to what we already have. But we have plantain smart mix, acha flour, bean flour, finger millets, acha grains, red beans. Just 6 out of the other brands that we have. Now, plantain smart mix is what I want to dwell on today. Why is it called plantain smart mix, and why is it an excellent choice for people living with diabetes or cancer or hypertension? It's plantain smart mix, so it's not 100% plantain. If you remember growing up or in school, when we were doing classes on nutrition, we were told that if you combine two different kinds of foods, you're going to acquire more nutrients. You're going to get more nutrients. Why? Because they are complementing each other. Yes, that is also one of the secrets behind plantain smart mix. Now, plantain is it's a root crop. Plantain is a fruit. We consider it a fruit, and it's healthy, but there are some nutrients that it does not contain, like protein. It's not a good source of protein, and it's not a good source of methionine, a type of protein that the body requires. It's an essential protein. So combining it with something else that is rich in protein, that is rich in methionine, that is rich in other vitamins and minerals, makes it a more nutritious food. So plantain in itself is good for you, it's healthy, but if you want to make the most, if you want to get the most out of it, then you should combine it with something else, which is why we have plantain smart mix. Now, there is also another reason behind the combination. Have you heard about glycemic index? If you have not, then I'm going to tell you a little bit about glycemic index, especially in the treatment of diabetes. Now, glycemic index is a rate at which the food that you're eating raises your sugar level. If it raises your sugar level very quickly, then that food is said to have a high glycemic index. If it does that slowly, then it has a low glycemic index. Now, in treating diabetes, you should aim for those foods that are converted slowly, not quickly. So plantain has what we call a low glycemic index. So it's a good meal for people who have diabetes. But there's also another aspect that people don't pay attention to. A lot of people don't even know about it. It's called glycemic load. And yes, plantain has a low glycemic index. The question now is, does it have what we call a low glycemic load? Which is why we have plantain smart mix. Now, when you eat plantain, because it is light, after 2 or 3 hours, you get hungry. And when you're hungry, what happens? You look for food and you eat. So you may have eaten something that has a low glycemic index, but if you still eat more than you should, you're going to be taking in too much carbohydrates if you have diabetes, and that will still lead to poor management. So you see the solution now. You see why there is something called glycemic load that we pay attention to, combining it with millet. Anything that is going to help improve this glycemic load, so that you eat plantain that has a low glycemic index, but it fills you up, it sustains you for a longer time, so it's solving a problem. So rather than get hungry after 2 or 3 hours, you find out that you can stay 4 hours, 5 hours, 6 hours before you eat your next meal. And what will be the outcome? Not consuming too much carbohydrates, achieving control. So you see why I call this CNC Smart with a food solution, and I have explained to you why plantain smart mix is an excellent choice, not just because the nutrients are improved, but because of glycemic index and glycemic load. So when next you want to eat your plantain, look for how you can help your glycemic load by combining it with millet, or you can look for CNC Smart Food plantain smart mix. Alright, now after the break, I'm going to tell you many more ways of how you can combine plantain smart mix with your meals. Thank you.
Citadel Nutrition Consult brings to you a premium quality plantain flour, Smart Mix. It is a unique blend of unripe plantain and finger millet for lower glycemic index, lower glycemic load, and improved nutritional quality. Plantain Smart Mix is rich in fiber, potassium, calcium, iron, and vitamins. Plantain Smart Mix is an excellent choice for diabetes management, weight loss, hypertension control, lowering bad cholesterol, fighting anemia, prevention and treatment of constipation, builds strong bones, improved mood and sound sleep. Available at Flourish Supermarket, Lamed Pharmacy, and other major supermarkets and pharmacies in town. You can visit our website www.cncsmartfoods.com for diet plan and consultation with dietitian. Call 0708-987-3467. CNC Smart Foods. Eat smart. Live well.
Welcome back to the show, Diet Talk with Dietitian Michelle. And yes, it's me. If you're just joining, I was talking about CNC Smart Food, an aspect of what I do. One of my passions as a dietitian, food processing, packaging of foods for the treatment and even for the prevention of diet-related diseases like diabetes, hypertension, obesity, cancer, kidney, and all other diet. And I talked about plantain smart mix, CNC Smart Food plantain smart mix. I said that it's combined with millet, which improves its nutrients, making it better, making it more nutritious. Then it also lowers its glycemic index and glycemic recommended for everybody. Or are all the food products packaged in CNC Smart Food recommended for everybody? No. Now, in the practice of dietetics, we don't like those roadside sellers of herbs, and you're going to be hearing it's good for staphylococcus, it's good for this, it's good for diabetes, it's good for, in fact, just one thing you're going to take and it's going to cure everything. No, that's not how we operate. Different foods are meant for different disease conditions. What might be good in the diabetes management might not be good for someone who has a kidney condition. And what you're going to use, of course, in the management of obesity is not what you're going to use in the management of undernutrition. So, different foods for different conditions. That is why we also have what is called a diet therapy pack. That is our work. That is what we are trained to do. Since we know the food combinations that will help you achieve results, we know the food combinations that will help you in the treatment, in the management of disease conditions, we can put that together for you. And so we have diet therapy pack, a carton containing different combinations, different products that can help in the treatment of diseases. So for instance, in the management of diabetes, it can be plantain smart mix, there can be acha grains, there can be acha flour, there can be beef flour, there can be tamba inside, and even a diet plan on how you can follow these meals. Then when we come to the diet therapy pack in the management of kidney conditions, there will not be plantain smart mix there. Yes, even though it's a healthy food, even though it's recommended in the management of diabetes, for those with kidney conditions, the nutrients are too much for the kidneys to handle. So you see, that is what we call medical nutrition therapy. There is no one size fits all. So if you're confused, if you're wondering, if you don't know what to eat, if you're already taking medications and you know that you're not eating the right things, then you need to see dietitians. We are trained to help you eat well. We are trained to help you see better results. That is what we are doing. We can plan the diet, tell you exactly how much carbohydrate you need to take, how much protein you need to take, how much fats you need, even vitamins and minerals that you should take. Even in the management of kidney conditions, there is a limit to how much potassium you should take. We factor that all in your diet, and we say don't consume more than 3,005 or 4,000 milligrams of potassium. You may not understand what it means, but when we plan the diet, we help you break it down, and it's simple. We just say eat this, eat that, and you're going to be managing your condition right. So we have the diet therapy pack. If you're wondering how you can get that, all you need to do is to send a text message to the dietitian's phone numbers. I'm going to call out dietitian's phone numbers and tell you how you're going to be able to send that message. If you text smart food to the phone number, then you say the disease condition and your state. So for instance, you can just text smart food to 0708 987 3497. 0708 987 3497, or the second number 0904 675 8079. 0904 675 8079. Then we are going to be able to help you combine your meals to help you achieve your results. So you can text smart food weight loss to this number just, or smart food diabetes to the number, or smart food cancer to the number. You can also text smart food kidney disease to the number. If you're not sure, just call us and we'll tell you if the disease condition is diet related and therapy. Now I also want you to know something about plantain. In as much as it's good for people who have diabetes, I have already mentioned before, and I'm going to say it again, there is no one size fits all, which helps to balance the sodium in the body. So if you have hypertension, it's good for you. Cancer is good for you. If you're trying to lose weight, yes, it's also good for you. Why? Because when you take plantain smart mix, it delays hunger, and so you're going to stay full for a longer time, 4, 5, 6 hours before you look for your next meal. But if you have a kidney condition, then you need to call the dietitians to recommend an alternative, a substitute to plantain. So you see what diet therapy means. Now you understand what diet therapy means. Different foods are recommended for different conditions. I'm going to open the phone lines now so that you can call in and ask me your questions. Remember, diet related questions. Alright, so the phone lines are open now. You can call and ask Dietitian Michelle, what can I eat to achieve this? And I'm going to be here to answer all your questions. And if you also want to pick up these things by yourself, if you've seen a dietitian before and you already know what to take, then you can visit the malls, the supermarkets here, or even the Flourish supermarket, Freedom, Icon store, and even pharmacies, because we know that medications and diets work hand in hand. So at Lamed Pharmacy, Myconi, Dilimi, and many other pharmacies, you're going to see CNC smart food, especially the plantain smart mix. And you can ask, is the dietitian food there? And they will guide you. All right. Hello. Good evening. What's your name and where are you calling from? Oh, thank you for calling. Okay. Okay. Have you gone to see the doctor? Have you checked your sugar level? Glycemic index. They are not easily converted to sugar in the body. Alright? So if you start with these ones and reduce the too many starchy foods that you are eating, try that for 1 month and then tell us the outcome. Alright? Yes. You've checked and the doctor said you're not diabetic. Okay. Oh, I see. Okay. Okay. Oh. Okay, so now let me tell you about gout, right? You need to be on what we call a low purine diet. A low purine diet are diets that are low in purine, and I'm going to give you examples of foods that are high in purine. What? Even some legumes. Do you know what legumes are? Legumes. You need to take out some legumes. Do you eat moi moi? Do you eat moi moi? Do you eat beans? Yes, we need to take those ones out of your diet as well, and you start to feel better. So in treating gout, you need to be on low purine diet. Okay, so I think you should see us and we'll be able to plan the diet for you, because if we're taking out legumes and taking out it and you will be able to achieve adequate nutrition and see improvement, okay, so that the condition does not get worse. All right, so see us at the clinic, or you can call the number. Okay, it's not every disease condition that is diet related. It's not every condition that we plan diet for. So in the case of glaucoma now, it's basically eating a normal, adequate, healthy, balanced diet. That is going to work best for you. Then there are some foods that are also good for the eyes. I'm going to tell you, there are foods that are very rich in vitamin E, and foods that are rich in beta carotene, like all the colorful fruits and vegetables, like tomatoes, carrots. Can you mention anyone? Okay. Okay. You think, okay, yes, watermelon, carrots, yes. So what you need to cut down on now is liver. Do you eat liver? Okay, so that's not necessarily the beef. All right, so take out liver from your diet, then eat more of these foods that you have mentioned, and of course adhere to your medications. You feel better. Okay, Madam Josephine? Yes, you're welcome. Thank you very much. And I consult there with other teams of dietitians, and we can